Okay, so now that you know the difference between a fake personality test, like those online dating sites and those in Cosmopolitan magazine, and the real thing, personality tests that are used in the field, that are approved by APA, that have gone through the peer review process and have shown to be highly reliable and valid. Okay. Now we're going to do something fun. I want you to become familiar with a few of the most reliable and valid personality tests on the market today. Okay, and so the first one here that we're going to cover, notice that this first category is self-report inventories. Self-report, this is your question and answer sheet. You fill it out, right, about yourself. Um, the idea here is if I want to know something about you, who better to ask than you? Who would know better than you? Okay. So the first ones we're going to look at are self-report inventories. And each of these tests is for a different purpose. Okay, so for each of the different purposes today that we're going to be looking at, I want you to become familiar with the most reliable, valid personality measure out there. Now, this very first one, some of you might have heard of before, depending on how many psych classes you have taken, and this is the MMPI. That stands for, as you see here on the slide, Minnesota Multiphasic Personality Inventory. Okay. The Minnesota Multiphasic Personality Inventory is used in clinical psychology. In other words, it's used by psychologists and psychiatrists who work with patients. And the purpose of this particular test used in clinical psychology, the purpose of it is to look for possible disorders. Okay. You might say, well, if they're looking for disorders and you're using a self-report inventory, how do we know people are going to be honest when they answer the test? They might want to appear more favorable and not admit to certain things. Okay? And that's a really good question. But I want you to think about this because there's a couple different ways to address this. First off, I want you to be aware that most people who go to therapy goes and do so because, to a clinical psychologist, go and do so because something is messing up their life and they really do want help. They want to find out what it is. They want treatment. They want help. And so they are motivated in that case to answer honestly, generally speaking. Now, there are some exceptions. There are some exceptions. For instance, if somebody is forced to go to a psychologist, a clinical psychologist, and to take this test, it might be, for instance, a court order. Okay. Well, there's something very, very interesting built into this test, and it is a lie scale. So there is actually a way, there are certain questions in here, and one of the first things that the psychologist will do after someone takes the MMPI is look at in the outcome, their lie score. Okay? If it's low, they're going to pay attention to the rest of the test and what it might possibly tell them. If it's high, then they're not going to give that self-report measure weight, in their decision on it, diagnosis. They're going to know not to trust it then. Okay, make sense? All right, I want you to see something here very interesting before we move to the next one. Okay, so this is part of the results of an MMPI for a particular patient. And it's a really great example here because you'll see that you've got the before treatment line here in the blue, and you've got an after treatment line. You also have a shaded area from here and to the left that is showing the normal score. Understand that, a psychologist or psychiatrist is never going to make a diagnosis of a disorder based on a pencil and paper test alone. Never. Okay. what they are going to look for is possible flags. So possible flags of a disorder. And in this case, for instance, you see that depression is a possible flag. But these really inform the therapist, on the further steps that they're going to take. For instance, they're going to be interviewing this patient a lot before they come to a diagnosis, and they can explore that idea further and see if there really is more evidence of depression, clinical depression. Okay. But they're going to use all these other tools, interviewing them, certainly one-on-one, sometimes interviewing the family too, if the patient agrees to that. Okay. Now, I also love this example of the scale, as I mentioned, because of the before and the after lines. So this is also kind of a cool way to see if therapy helps somebody. And it doesn't always, right? One particular form of therapy may not help a particular patient. So it's a great way to kind of keep a record. And you will see that this particular patient, after being in therapy for a couple of years, and at the time that the patient felt they were ready to quit therapy, and so did the psychologist, it's very customary that a psychologist will give them the test again then at the end. And you can see that now all of their after scores are actually within that shaded normal range. Okay, so really therapy had a significant effect on this particular client. Okay, the next test we're going to look at here is a 16 PF questionnaire. The PF stands for Personality Factor Questionnaire. The 16 Personality Factor Questionnaire is used for something very different. It's used for business. But I'll tell you something that's similar. No employer in their right mind would hire somebody for an important position based simply on their answers to a self-report personality test. So the proper use of this is when you have a particular position, important position in your company, you generally get it narrowed down. There are other things you're much more interested in knowing about people, right, that are far more important than their scores on a personality test. You would want to know about your applicants, for instance, their education, their experience, their references, any awards and other recognition that they've gotten in their field, how reliable and dependable they are, et cetera, et cetera, et cetera. These things are also all far more important. You need to find this information out first. And oftentimes personally interview them, because you can find out about additional things through a personal interview, like social skills, for instance. Anyway, when you have an upper level position at a company, oftentimes it will get narrowed down to like 3 or 4 equally qualified candidates. And this is where the 16 PF questionnaire really comes in handy. And again, this is a really cool questionnaire. Let me show you something. For different occupations, certain different occupations, the 16 PF questionnaire ideal has kind of been put together. In other words, very best people in that area of work have been tested on the 16 PF questionnaire, and the mean scores for them, have been compiled, and so that they have what is called a template for the best, for instance, airline pilot. So that's what we're looking at now. A template for a good commercial airline pilot. Super interesting. If you look at this carefully, you'll see that you want, your pilot to be emotionally stable. You certainly want them to be controlled. You want them to be tough-minded, but you don't want them to be too tough-minded, right? Too macho. You want them to be relaxed, very important. But again, you don't want them to be too relaxed and falling asleep on the job. So very cool personality test there. Now this third one, you are going to be doing. This is one of the most valid, reliable tests out there, and it is the most reliable for what it is used for. This one is used for research. In other words, just to look at differences between people that help to predict different kinds of behaviors. Okay, so you're going to be doing this in your assignment. This was the one we talked about, is based on what is called the Big Five, the NEO personality inventory. And don't ask me why it is only named here, given the initials of 3 of the 5, but it is actually based on all 5. Okay, and so let's quickly take a look at these 5. What are the Big 5 personality categories here? And you'll see at the very top we have agreeableness. Okay, for right now, I just want you to remember that as warm. Okay, someone has a warm personality. There's really a whole cluster of traits in here, and when we get to the trait approach in this class, then we're going to expand this more so that you learn more about this concept of the Big 5, each of them. But for right now, I want you to remember that agreeableness is warm or nice. Okay. Let's work backwards here. Neuroticism, you can just simply think of that as worried for now. Again, a whole cluster, but pretty well represented by worried. Okay. Then we have extroversion. People are usually familiar with extroversion. That is very sociable, right, or outgoing. Okay. Openness. Sometimes people are not that familiar with this one. This one might better be thought of as open-mindedness. Okay, so wait a minute, this means we can't do our scale. We just use that as a hypothetical example because look, somebody's already done it and they've done it really, really well. And you will actually be testing yourself and someone else that you know on open-mindedness. So for open-mindedness, what I want you to remember for that one is there are many things under this. Okay, many things. It's a cluster. So it might include things that are more intuitive with the name, like being open to other ideas than your own. And we'll talk about that further later on. But for right now, I just want you to remember that that's a good one. Open to ideas that are different than your own. We're all open to our own ideas, right? But how open are we to hearing about other people's different ideas? And then we have conscientiousness. This is probably one students mix up the most. There is a tendency to sometimes think that this means consciousness. Okay. Hopefully all of you out here watching this video segment right now are conscious. Okay. But I can guarantee that not everybody who will be watching this is conscientious. Okay. Conscientiousness. The one thing I want you to remember with this one is attention to detail. In other words, very careful. Okay. And of course, we vary on that, right, in our class. Okay. Here is an example of NEO personality inventory printout. This is the graph at the end. So you're going to be graphing your own scores, and it's going to look like this by the time you finish, something like this. Of course, your patterns will be different. Notice that, you know, you've got the Big 5 over here summed up. So overall, the Big 5 over here on the side. And then you've got each of the different subtraits. And notice that for each of these, I said there was a cluster and there's even more than 6 traits, but you've got 6 of the different subtraits under each of these that you'll be measuring and comparing yourself with somebody else that you know. So then you'll be doing somebody else's scores, graphing them on the same graph, but, you know, then using red ink. Okay, and you then will be able to see physically where your personalities, where they converge and where they diverge from each other. Okay, where you're similar, where you're different. A super interesting assignment.